Hello, my dear future nursing officers. Welcome you all once again to the Master Nursing classes. So, in the last previous sessions of the pharmacology, I have given my best shot on the each and every questions and the highest probability questions which are there and which are having the chance to get come in your exams. So, in this today's session, I told in the our WhatsApp channel and Telegram channel, I have shared this is the magic session, and only I am focusing on the those very important questions which will comes in front of you all in your computer screen when you will sit in your prelims and mains exams, right? So a very good evening to one and all who are watching the session. So please do hit the like button and subscribe to the channel. If you are subscribing, then only the notification will comes to you, okay, for the next classes. If you are not subscribing, the notification will not comes to you for the next classes, so you will miss the class, okay? So don't miss any magic sessions, because these are the sessions which highest probability of the coming the questions with the same options in your exam. So, and whatever the concept I am explaining behind the particular session, so that is the very important to every one of you. So I am requesting you to don't miss any class for the next 5 days, okay, because these are the very important classes, okay? So yes, a very good evening to one and all. And if anyone of you are new to, so please do subscribe to the channel and share the video with your friends, okay? So without wasting the time, we will start the today's session of the magic session for the Norcet exams and any other state and central government exams. Students, we will start the session with this powerful motivational image here. So whatever the image you are seeing on the screen, that is the Indian cricketer Hardik Pandya, okay? Before the T20 World Cup, when he was a captain of the Mumbai Indians, so that time the entire Wankhede Stadium of the Mumbai, so they are calling him as a Chapri, Kala Kawa Hardik Pandya, like this. So some abuse and bad words they used to use for a champions. But he didn't went for the depressions. He didn't compromise himself. He worked on his athleticism, and here is the real image which motivates you people. Look at the attitude of the person. What he hold in his hand. So that is the T20 World Cup. This is what we should implement in our life. What we should come back from the our backlog stories. Students, remember, never ever compromise yourself. Never ever think negatively among like especially about yourself. So you are a champion. You are made for something big, and you can do anything if you believe in yourself, right? So always our setback story, our comeback story should be stronger than the setback stories. Our bounce back should be should reflect in front of our enemies. Yes, without words, it should reflect in our attitude. So then only we can, and some people in the society will recognize us, and some people in the society will believe in us, right? So never ever think negative about yourself. Even entire world is against you, so then also not think negative about yourself if you are really true. Yes, so have attitude of the champion and have a mindset of the victory. Then only the everything which is required to you, it will come to you if you are really working on it, right? So he worked a lot on his athleticism. He worked a lot on his particular cricket, and he holded that particular cup in his hand. Okay, so victory is not a tea of everyone's cup. Okay, victory comes to those who work hard, like Hardik Pandya, right? So with this powerful motivational images, today's class will start. Okay, so please do remember, completely be attentive and active in the comment box, and try to involve completely in the question solving sessions, and whatever the explanation I am giving, so please do at least take a screenshot and revise at least 1 or 2 times in after immediately after completing the particular session, right? So here comes to the first question in front of you all. So try to read the question carefully, completely, and give the best shot and best answer in the comment box. Yes, the question is here. Which of the following is the most common cause of the fever on the post-operative day 1? Yes. Which of the following is the most common cause of the fever in the post-operative day 1? So what goes to the correct answer? Option A, urinary tract infection. Option B, wound infection. Option C, pulmonary atelectasis. Option D, deep vein thrombosis. Yes. What is the post-operative day 1 fever most common cause? I'm waiting for your answer in the comment box. So please do share the session with your WhatsApp status and in your WhatsApp group, so it can help your friends also to get motivated and get boost and get prepared for the exams. Yes. So here comes to the correct answer, and almost all few of you have given the best answer for this session. Particular question, that is the pulmonary atelectasis goes to the most common cause for the post-operative day one. Okay, sir, why? What is the reason for the post-operative day one fever? So that is the pulmonary atelectasis. So here, beta, the pulmonary atelectasis is happening due to the, yes, effect of the anesthesia. Effect of the anesthesia, the alveoli are getting collapsed after the post-operative, in the post-operative period, especially in the day one, the alveoli are getting collapsed, means we call that one as atelectasis. Okay, that is the pulmonary atelectasis, the most common cause for the day one fever in the post-operative patient. In order to prevent that one, we will educate the patient to use the, yes, incentive spirometry. Okay, so we will ask the patient to at least to lift the 3 balls. Okay, so to expand the lung properly. So when we need to educate the patient, whether post-operatively we need to educate for use of this spirometry, or we need to educate pre-operatively only. Yes, when to educate the patient for the using of the incentive spirometry to expand the lung of the patient. Better, after the surgery, patient will be in a state of the pain, and whatever thing you will explain to the patient, he will hear, but he will not understand and he will not apply. So in order to make use the more effective communication, whatever the thing you want to explain to the patient, that is immediately after the surgery, okay, you have to explain everything that is just before the surgery or the in a post pre-operative days. Okay, so how to use the incentive parametry and how to cough by applying the simple pressure on the suture in order to prevent the dehiscence and the evisceration, and how to use the breathing techniques to prevent the atelectasis. Everything you have to explain before the surgery, because after the surgery patient is in a state of the pain, and whatever thing you are doing, so that is goes useless. Okay, so that is the thing. Pre-operatively we will educate the patient to use the incentive spirometry, and very important thing, and how to keep the pillow on the suture to prevent the like separation of the suture during the coughing and all. Okay, so that's the thing what we need to educate importantly to the pre-operative patient. Okay, I hope the concept is very much clear. And here comes to the a very important table. Better, it is not in simple table, it is in the very important table, and it is completely updated table. Okay, so please do remember. Okay, post-operative day and cause of the fever, very important. So this question have been already asked in the Norcet exam. The post-operative day 0 and day 1 cause for the fever is the atelectasis, that is the collapse of the lung alveoli. Okay, so then comes to the day 1 to 2. Okay, especially day 2. Day 2 cause of the fever is the pneumonia, very important. Okay, so due to the effect of the anesthesia, again here the lungs will get consolidates because of the it is unable to remove the secretions out of the lung. So accumulation of the secretions which makes the lung parenchyma to get infect. Okay, the infection of the lung parenchyma, what we can say that one as in the pneumonia. Okay, so that's the day 2 most common cause for the fever is the pneumonia. Then comes to the day 3. Okay, day 3 to day 5. Okay, the deep vein thrombosis and the surgical site infection, the 5-star words for your exams. Okay, so that is very important, don't forget. When the surgical site infection happens, surgical site infections not happens immediately after the surgery, it happens after 48 to 72 hours after the surgery. Do remember the golden word, it will help you to eliminate the wrong option. When the surgical site infection happens, usually it will be seen after the 48 to 72 hours after the surgery. Okay, so that is after 3 to 5 days. Okay, the surgical site infection signs symptoms will be seen. Okay, so do remember. And the cause of the fever day 3 to day 5 is the deep vein thrombosis. In order to prevent the deep vein thrombosis, what we have to do to the patient? Yes, we will encourage the patient to do the early ambulation, the very and the golden word. Okay, after the surgery, in the post-operative days, in order to prevent the deep vein thrombosis, so we will educate the patient to walk as soon as possible after the surgery, immediately after the stabilization of the patient. That is what we call as the early ambulation. Very important. Okay, please do keep in your mind. Then comes to the day 4 to day 6 cause of the fever. That is the burst abdomen. What is the burst abdomen? Look at the image, beta. Look at the image. Surgery have been happened and infection have been produced inside. Intra-abdominal pressure increased. Suddenly, the entire GI content which came out of the surgical site. This is what you call as in the burst abdomen. So, burst abdomen usually happens on the day 4 to day 6 after the surgery. Very, very important. Your exam question, image based question for the prelims or mains, anywhere it can ask to be. Okay, so this is a case of the burst abdomen. This is a case of the burst abdomen, that is the sudden outpouching of the entire GI content from the surgical site. Okay, that is what we call the burst abdomen. Sir, what is the cause of the fever in the day 5 to day 7, sir? That is the intra-abdominal abscess. Okay, especially in the pelvic cavity. The remember, most common site is the pelvic cavity. So please do remember at least two things from this chart. That is the post-operative day 0 to 1 cause atelectasis, 3 to 5 cause DVT, surgical site infection. And when the burst abdomen happens, that's from the 4 to 6 days after the surgery. Okay, so the most common site of the intra-abdominal abscess after the surgery is the pelvic cavity. Please do remember, this is the image of the burst abdomen. Sir, now the burst abdomen happened and I am a nursing officer working in the post-operative unit, and suddenly in a patient which is the post-operative day 4 to 6. Okay, so now I have seen the patient with a burst abdomen. Okay, so what is the next step of the management, sir? Just we need to cover the exposed area and the surgeon will come and do the surgical procedure in the minor OT. So that is what we call as then the bag-to-bag surgery. What we call that one as the name of the surgery we will do in the burst abdomen. So that is called as the bag-to-bag surgery. That is the BOGOTO, bag-to-bag surgery. Very, very important. Okay, so this will be very important. But this image have been asked already in your Norcet exam, so don't forget the bag-to-bag surgery, or we can call this one is in the urinary bag laparotomy. Okay, so that is the we are closing the exposed area by using the urinary bag. Okay, this is what we are using, this plastic sheet. Are you able to see? So this is the urine bag. Okay, which bag that, because that is the urine bag is the sterile one. So just we will cover that one and we will do the suturing at the along side of the entire abdomen. So the purpose is to keep the intra-abdominal content inside only, and we can access the intra-abdominal content easily if the intra-abdominal pressure is increasing and the abdominal compartment syndrome is happening. Means in that situations we can easily suddenly open and relieve the pressure. Okay, so that is the reason the bag-to-bag surgery will be a temporary closure. It is not in permanent surgery, beta. It is in the temporary closure of the exposed area of the abdomen. The very, very important question and the concept all you people have to remember and understand and give the best to best answer in the exams. Here comes to the image based questions. Identify the image. Identify the image. Identify image. Yes. Option A is the burst abdomen. Option B is the bag-to-bag abdomen. Option C is the evisceration. Option D is the dehiscence. So what goes to the correct answer? Is this the dehiscence or the eviscerations or the burst abdomen? What happened here? So this is the area where the surgery have been done. Okay, and here are the sutures. Here are the suture marks are there. But in middle, in this particular area, the suture lines are separated. So what we call this particular case as an, what is the case is this? Yes, well done, beta. Okay, if the suture lines just separated, we call that one as in the dehiscence. Okay, what we call that one is in the dehiscence. If the suture line is separated and the organ which is coming out of the particular separated area, we call this in the evisceration. In the evisceration, the viscera will come out. The viscera means the internal organ will come out of the opening. So that is what we call as in the evisceration. And just a suture line is just gets separated. The organ which is there inside, which is not coming out, just the suture line is separated. We call that one is in the dehiscence. Okay, this particular situation also a case of the dehiscence. Just only suture lines are separated. Okay, but the internal organ not came out. Okay, this is the case of the dehiscence. Very, very important. So please do keep in your mind, right? So here comes to the next question. Okay, so very, very important question. Next four questions I will solve on the ABG. The entire concept of the ABG I will finish. You will get at least 4 to 5 questions on the ABG in your prelims and the mains exam, including at least 3 to 5 questions. Definitely they will ask on the ABG, that including the a collection of the sample of the ABG and Allen's test interpretation of the ABG. So that is including the simple ABG interpretation like metabolic alkalosis and acidosis, respiratory alkalosis and acidosis, or the complicated, little bit simple and just next to the simple, that is the partially compensated, uncompensated, or fully compensated. Okay, so these kind of the questions will comes in your exams. Okay, just I am here to fix so those 5 questions which help you to boost and get the best rank and clues in the word of the question. Okay, what you have to search, because beta these interpretation questions take little bit extra time. Okay, so other questions it will get take around a 35 to 50 seconds we will solve the other questions, but the some calculation questions and interpretation questions it takes around a 1 to 2 minutes for the each question, so which may damages us to get cover entire 18 questions in the one section, because you know in the 20 like in the 18 minutes we have the 20 questions. Okay, and we are struggling in one questions for the duration of 3 minutes and 5 minutes, and we are unable to go for the next question. Means okay, among 20 questions we are able to see only 16 questions, and remaining 4 questions which are coming at the last are very easy questions. Okay, that you people are skipping, means that will definitely damage the result. Okay, so that is the reason I will give the simple clues to interpret and to get the correct answer. Okay, by holding that particular clue and by using this particular technique what I am teaching to you people now, so this will help you to solve this particular ABG questions within a time frame. You can solve this one within a 35 to 45 second very easily. Okay, and you can go to the next question and you can see all the entire questions in the entire 20 questions among the within the 18 minutes, and you can save at least your 2 minutes in the a particular 18 minutes. Okay, so that is the purpose of the giving the clues for the solving the ABG question. After the 4 ABG questions, the questions will come on the direct calculation, the 3 types of the questions. Okay, which will come in front of you in the exams. So what are the three types of the questions, and how immediately we need to apply the formula and to get the correct answer, and what is the actual technique you have to use, I will teach that one also. Better teaching the content is like everyone will do, but how to effectively use that one in the exams, that is only a work of the Nagraj sir, and here will be our master to solve everything, so don't worry. Okay, so comes to the discussion point here. A patient's ABG shows a pH of the 7.30 and PaCO2 is the 50 mmHg and bicarbonate is the 24 milliequivalent per liter. What is the likely diagnosis? What is the interpretation of this particular thing? You have to understand here. Okay, so so let's immediately revise all the normal components of the ABG interpretation. Okay, what is the normal blood pH? Normal blood pH is the 7.35 to 7.45. Okay, so this is the normal blood pH. Okay, so what is the normal PaCO2? What is the partial pressure of the carbon dioxide? Do remember, bring this 35 down, bring this 45 down. That is the 35 to 45 mm of Hg is the PaCO2 level. What is the normal bicarbonate level? HCO3. Yes, HCO3 level is the 21 to 28 milliequivalent per liter is the normal bicarbonate level. What is the PaO2 level? That is the partial pressure of the oxygen. Yes, that is the 80 to 91 mm of Hg. Okay, in some book it is given only 85 mm of Hg. Both are same because it is coming in the range. Don't worry. Okay, if it is going below 80, then only you think it is dangerous. Okay, so if it is above 80, it is okay, no problem, right? So here comes to the normal parameter we need to understand here. Better first thing you have to use the technique of the elimination. Okay, so that is how, sir. First thing what you have to see, whether we have to interpret it, whether it is a case of the acidosis or the alkalosis. Sir, how to interpret? By seeing the pH. Okay, so if pH is less than 7.35, that is the acidosis. if the pH is more than 7.45, that is the alkalosis. Okay, so now in the given question the pH is the 7.35, then I will directly come to the options and I will eliminate the alkalosis options. Okay, so here is the alkalosis, here comes to the alkalosis. Why sir? Why? Because the pH is the 7.30. Okay, this is the case of the acidosis, so I am eliminating the both options. Yes, half of the work done within a 3 seconds or the 4 seconds, half of the work done. Okay, so next comes to the next point I have to keep in our mind, whether it is a respiratory problem or the metabolic problem. Okay, so just comes to the next parameter. Okay, if the PaCO2 problem is there, that is the respiratory problem. If the bicarbonate problem is there, that is the a metabolic problem. Consider here the bicarbonate is the 24 milliequivalent per liter is there. Okay, but the normal bicarbonate, you know, that is the 21 to 28 milliequivalent per liter. Okay, so it comes under the normal only, so it is not a metabolic problem. So the remaining one thing, that is the PaCO2. Okay, so you know the value, normal value of the PaCO2, that is the 35 to 45 mm of Hg. Okay, so here comes in the option, that is the 50, means the PaCO2 have been increased. Okay, beta, whenever the carbon dioxide accumulates inside the body, okay, that time the acidosis will happens. Which acidosis? That is the respiratory acidosis will happens. Okay, whenever the carbon dioxide excessively eliminated from the body, so that time what happens? Alkalosis happens. Which alkalosis? Respiratory alkalosis will happen. Okay, so now here the carbon dioxide have been increased in the body, that is the PaCO2 is the 50 mm of Hg. Okay, which is more than 45 mm of Hg. Okay, so here comes to the answer, that is the respiratory acidosis. Okay, so this is how first thing look in the question, whether it is in the acidosis or the alkalosis. If it is acidosis, eliminate the two alkalosis. Okay, then comes to the next point, whether it is the respiratory or metabolic. If the PaCO2 problem, respiratory, whether it is the bicarbonate problem, metabolic. Hope the question is clear and important and perfectly explained to everyone of you. Okay, so this is a simple trick to choose the correct answer in a very quick manner without wasting the time in the exams. Okay, so if we have the time, okay, you can spend more time on the interpretation questions. If you don't have the time, use this technique. It will help you to get the good marks in the exams. Okay, so that's the very, very important thing. Okay, here comes to the next question. Yes, and almost all you people given the 100% correct answer for the last question. So students, if anyone of you have want to study the ABC in detail, there is 1.5 hour lecture video is there in the YouTube channel of the Master Nursing Classes, the same channel where you are watching. At the end of this particular video, I will give the link of that video in the description box. Please do watch the video. The practical thing, the interpretation thing, the complicated thing, how to interpret the compensated, uncompensated, very, very easy manner. No one in the India, no one in the world explained the ABC in such easy manner. So your master sir explained that one, your Nagraj sir explained that one in a such easy and perfect manner. So if you want to be excellent in the interpretation of the ABC, so please do watch the video. After completion of this video, which is completely dedicated for those students, just they are appearing for the Norcet 9 exam and they want to score the good marks in the ABC interpretation and other questions of the calculative questions. Okay, so if you want the knowledge, complete knowledge, the video is there for you also. Okay, so you can watch immediately after this particular class. Okay, here comes to the question, that is a 25-year-old man presents with a 2 days history of the profuse diarrhea. What happened to the patient? The profuse diarrhea happens and his ABC reveals the pH of the 7.30. Again, this is the case of the, yes, this is the case of the acidosis or the alkalosis. Please do mention. Yes, this is the case of acidosis or alkalosis, beta. The pH is 7.30. Very well done. This is the case of the acidosis because the pH is less than 7.35. Okay, so that is the very important. Then comes the next, that is the HCO3, that is the bicarbonate, is the 70 milliequivalent per liter. Yes, the bicarbonate is decreasing, means bicarbonate is very, very important thing which we need to maintain in the blood. If the bicarbonate is normal, so pH will be normal. If bicarbonate increases, the pH will decreases. If bicarbonate decreases, the pH will increases. Okay, so very, very important. Keep in your mind. Okay, here the bicarbonate is decreased. Okay, so in the sense the acidic level of, sorry, the pH bicarbonate is decreasing means the H plus ions will increase, not pH. Okay, the H plus ions will increases, and bicarbonate is increasing means the H plus ions will decreases. Okay, so bicarbonate decreased means acidosis, bicarbonate increased means alkalosis. Very simple, just keep in your mind, right? So then comes to the PaCO2 is the 30 mm of Hg. So what is the most likely cause of the acid base disturbance here? First we will interpret this one. Okay, then we will go for the cause of the our acid base imbalance in this particular situation. Okay, so pH given is the 7.30, means it is less than 7.35. So I will write this one as in the acidosis. Okay, so the next bicarbonate is the, yes, that is the 17 milliequivalent per liter. Okay, the bicarbonate is decreased. Okay, this is the case of the problem of the metabolic. Okay, so that is the acidosis. Okay, so metabolic acidosis is the condition. And PaCO2, what happened here? PaCO2 also decreased. Normal one is the 35 to 45 mm of Hg. Better, I told PaCO2 is decreased means actually a respiratory alkalosis should happen here, but the alkalosis is not happened here. It is the pH is low, means it is not in the respiratory problem, it is the metabolic problem. Okay, so this is the case of the metabolic acidosis. Okay, this is the case of the metabolic acidosis, right? So here why carbon dioxide is decreased means it is decreased to compensate. Okay, so now carbon dioxide is decreased and it is trying to compensate, and pH not came to the normal, but the lungs is trying. Okay, so lungs is trying means, so it is called as the partially compensated metabolic acidosis, right? If carbon dioxide decreased here and this pH comes to the normal, then we call that one as the fully compensated metabolic acidosis, and this particular PaCO2 is remains normal, and the pH and the bicarbonate is the both decreased, so that is the metabolic acidosis, which is completely uncompensated. Okay, so uncompensated means the PaCO2 is remains normal and PaCO2 decreased, but pH not come to the normal is the partially compensated, and PaCO2 decreased and pH came to the normal, that is the fully compensated. Now here the PaCO2 is decreased but pH not comes to the normal, so this is the partially compensated metabolic acidosis is our interpretation. So why it happening? It happening due to the profuse diarrhea. So the question is what is the most likely cause of this acid base disturbance? Better, you have to remember one very important concept behind this particular question here. Okay, so please do remember. So this is our GI system. Okay, so this is a food pipe, or we otherwise we call this one is in the esophagus. Okay, and here will be our a food storage system, that is what we call as the stomach, and here comes to the duodenum, right? So this particular esophagus and stomach, which is acidic in nature, Why? Because here we have a dangerous acid, that is what we call the hydrochloric acid. Okay, so very important, please do remember, right? And this particular duodenum and all the duodenum and whatever the jejunum, ileum is there, so these all things are the alkaline in nature. Okay, alkaline in nature. Why, sir? Why? Because here the abundant one is the HCO3, that is the bicarbonate abundant in the lower GI system, and the HCl is abundant in the upper GI system. So normal pH of the upper GI system is the very acidic, and normal pH of the lower GI system is the alkaline. Okay, so if a patient is experiencing a vomiting, consider the patient is experiencing the vomiting, or the patient is having the intermittent or continuous NG tube suctioning, that is the nasogastric tube suctioning, or if we done the stomach wash to the patient intermittently. Okay, so stomach wash intermittently. Okay, that time what happens? This HCl, it will comes out, means acidic thing which is going out of the body. So acidic thing which is going out of the body means H plus ions. What happens? H plus ions will get decreases. H plus ion will get decreases means pH, what happens? pH will get increases. Okay, the pH is increasing means the what happens here, the situation what we call as the alkalosis will happens. Okay, so which alkalosis will happen? Here the metabolic thing is getting lost, so that is the metabolic alkalosis will happens in case of the vomiting, in case of the NG tube suctioning, in case of the repeated stomach wash. So the which metabolic abnormality happens? That is the metabolic alkalosis will happen due to the loss of the H plus ions. Hope the concept is very much clear. Okay. Similarly, if the patient is getting the diarrhea, so entire content from the duodenum, jejunum, ileum will get lost. Means excessive bicarbonate it will get eliminates from the body. So bicarbonate is eliminating means what happens? The H plus ions, what happens? H plus ions will increases. H plus ions will increase means pH, what happens to pH? pH will get decreases. Okay, so pH is decreasing means, so what happens here? Here the it will be a case of the acidosis. It will be a case of the acidosis. Okay, so this acidosis due to the deficiency of the bicarbonate, I call this one as the metabolic acidosis. Metabolic acidosis. Yes, if the patient is having the vomiting, then the metabolic alkalosis will happen. If the patient is having the diarrhea, that time metabolic acidosis will happen. Okay, so in the question, it is the case of the metabolic acidosis. Why it is happening? It is happening due to the loss of the bicarbonate or the loss of the HCO3 from the GI tract. And almost all my proud students who all are attended the last ABC session completely given the best answer for this particular question. I'm very proud of you all. So this concept of the diarrhea and vomiting, it may comes to in your exam. So why I have explained this one here in this particular this much details slowly and perfectly means, if you found the word vomiting, so just try to think about it, a case of the metabolic alkalosis, right? And if you found the word diarrhea in the questions of the ABC interpretation, try to think about the metabolic acidosis. So this is the trick what I want to give, and this is the thing just for your sudden grasp of the question and to give the you can grasp the question easily means you can crack the question easily. Okay, so grasping the question is the most important. So I am giving the clue. So to solve this particular question very easily, here it took 3 to 5 minutes to explanation, but in the exam it takes a 30 seconds to get solved because your Nagaraj sir created the concept which will come in your mind immediately. Then you can solve the question very easily. Okay, so but don't just go from only one clue. Okay, completely read the question, understand the question, then comes to the options, then read all the options, then choose the answer based on the clue what I have explained. Okay, so when you have to apply the clue after the complete reading of the questions and complete reading of the options. Okay, just don't only see the diarrhea and just don't only choose the answer directly. Okay, so even after they have mentioned the diarrhea, try to read the complete question till the end, complete answers, then apply the concept, the result will be yours. Okay, the rank will be yours and the name will be yours in the selection list. Okay, so hope it is clear to every one of you. Don't forget beta, don't do the silly mistakes. I don't call this one as the silly mistake. This is your negligence and avoidance. So don't do that one in the main exam. Okay, so that is the reason the master nursing classes application, in the application we have kept the real-time exam situations that is free of cost to the every aspirants who are attending for the Norcet prelims and the Norcet main exams. Okay, so if you want to become a like champion to practice the real-time exam, so please do download the master nursing classes. Yep, it's absolutely free test we are conducting to the all India level, and you can assess your rank also, and you can assess your performance also, and you can assess yourself before going to the exam. Okay, so do download the master nursing classes. Yep, I have given in the description box, link is there. Okay, so here comes to the next question, right? So here's the next question, every one of you. So please do read the question carefully, completely, then try to do the best shot to the particular question. Apply the clue. Yes, I want answer in the 30 second, guys. Yes. In between, I am unable to read the comment because if something I am reading from your side means whatever the concept I want to explain to you people, so that will get missed. So that is the reason whenever I will give the question in front of you, then only I will read the comment, and whatever the thing you want to comment, so please do comment during the whenever I will watch down to the screen, then only you can comment. Okay, whenever I am explaining the thing, so that time you are commenting means there is the waste of your time. Okay, so here but still if you can comment and involve, but what I'm saying, if you want to ask directly anything to me, so please mention it while I am explaining while I am watching to the your screen. Okay, so here comes to the next. A 22-year-old woman with a eating disorder presents with a weakness and she admits to frequent self-induced vomiting is there. So patient is here with us. So that is the having the eating disorder and she is having the frequent self-induced vomiting. And her ABG is the 7.50 is the pH and the bicarbonate is the 34 and the PaCO2 is the 48. So what is the acid base disturbance which happened here? Yes, first thing what we have to do, look at the pH and eliminate. Okay, so it is more than 4.5. More than 4.5 means that is the alkalosis case. Okay, so just eliminate the acidosis. Okay, so 2 acidosis I have eliminated here. Okay, so the next one is the what happened to the bicarbonate? What is the normal bicarbonate? That is the 21 to 28 milliequivalent per liter. So this is normal bicarbonate, and in the given question the bicarbonate is 34. So bicarbonate, what happened? Bicarbonate increased and pH also increased. Okay, so bicarbonate increased, pH also increased means it's a case of the metabolic. It's a case of the metabolic alkalosis. Very simple. Within 30 seconds you can choose the answer. Okay, here comes to the PaCO2. So that is the, it is little bit increased. Okay, so it is little bit increased to compensate. Okay, so but the pH have been not came to the normal. Yes, PaCO2 increased, but pH have not came to the normal means it is in the partially compensated. Okay, it is the partially compensated metabolic alkalosis. Very important. So please do remember. Okay, so I hope it is clear to every one of you. Yes. So here comes to the next question. Yes, fatafat. A 40-year-old patient with a mechanical ventilator. Okay, the patient is on the mechanical ventilator is noted to have the ABG pH of the 7.55 and the PaCO2 of the 25 mmHg and bicarbonate of the 24 milliequivalent per liter. What is the change to ventilator setting, which is most important, which is required here? Okay, so what happened? The case, first try to identify the case. The patient is on the mechanical ventilator and the pH is 7.55 and the PaCO2 is decreased. Okay, means there here the patient is underwent the hyperventilation. Patient underwent the hyperventilation. Why hyperventilation happened? So in the ventilator setting we have kept the more respiratory rate. Okay, then the hyperventilation happened. All the carbon dioxide which was there in the body, it will get eliminated. Okay, so the normal PaCO2 would be the 35 to 45 mm of Hg is the normal partial pressure of the carbon dioxide, but in our question it is only 25 mm of Hg is remaining. Okay, so the excessive accumulation of the particular carbon dioxide inside the body means that time the respiration have been decreased. If like excessive loss of the carbon dioxide from the body means that is the respiration have been increased. Okay, so here the PaCO2 decreased and the pH is increased. So that is the case of the respiratory. It is a case of the respiratory alkalosis. Okay, so in the respiratory alkalosis, first thing what we have to do in a patient is the, yes, increase the tidal volume. Beta tidal volume means a amount of air which will inhale and exhale in one particular respiration, that is the tidal volume. So the normal amount of the tidal volume is the 500 ml. Okay, so already patient is in a state of the hyperventilation and you are increasing the tidal volume. Again the patient will go into the hyperventilation. Again the respiratory alkalosis will increase. Again the patient will land into the metabolic imbalance. Okay, metabolic acid base imbalance, and the patient will die. Okay, so don't increase the tidal volume here. If in the option it was decreased, so we would have think about it. Okay, so next comes to a decreased respiratory rate. Beta, yes, hyperventilation happened, so now you have to decrease the respiratory rate setting in the or mechanical ventilator. So the very important, it will be easily explained to everyone of you. Okay, why? Because in the situation it was the hyperventilation. We are reducing the respiratory rate means yes, it will comes to the normal respiration. Then we will advise along with this, after reducing the respiratory rate, okay, in order to replace the carbon dioxide, what we will do, we will educate the patient to use the paper bag. Okay, paper rebreathing bag. Okay, so that's the paper bag rebreathing. Okay, so very important. So we will give the one paper bag to the patient and we will ask the patient to hold at the mouth and we will ask her to exhale the thing and inhale the same thing. So in the exhalation there is a carbon dioxide is there, it will go to the body. Okay, so the like lost carbon dioxide from the body will get replaced. Okay, so this paper bag ventilation or the paper bag rebreathing is the most important treatment for the respiratory alkalosis. Okay, so please do remember, this was your last Norcet question. Okay, this was your last Norcet question. Very important. Okay, so how to, yes, is how to replace the lost carbon dioxide by advising the patient to breathe in the paper bag. Okay, so this is the very important point for your exam. Okay, next is the increased FiO2. FiO2 means a fraction of the oxygen inside the inhaled air. Okay, so I'm inhaling the 50 ml, I'm inhaling the 500 ml of the air, means in that one how much oxygen is present. Okay, so normally FiO2 is the, that's the 21. Okay, so 21 mf, which is the normal FiO2 will be there. Okay, so this is the fraction of inspired oxygen. Okay, so then decrease the PEEP. So what is the PEEP? That is the positive end expiratory pressure. That was the PEEP at the end of the expiration. So there will be a positive pressure which will help us to our alveoli to keep open. Okay, so that is the PEEP. So PEEP we will usually, and PEEP we will keep maximum as in the 6 mm of FHG to maintain the in order to prevent the alveolar collapse. Okay, so that is the very important. Here it is not having any role. So hope the concept is clear on the treatment of the our respiratory alkalosis. Okay, hope it comes to the which gives the very clear explanation to you all. Okay, so here comes to the next question. So please do read the question and try to choose the best answer for this particular question, because it's very important question again for you all. The lead which is placed at the fifth intercostal space anterior axillary line is, which lead is that one? Option A V4, option B V5, option C V6, and option D V3. What goes to the correct answer? Yes, what goes to the correct answer? At the fifth intercostal space anterior axillary line. So here comes to the image. Okay, beta. So please do understand the concept here. Okay, so this is the right side of the body and this one is the left side of the body. Okay, so here will be our heart located like this. Okay, here will be our heart located like this. Okay, so how we have to place the chest leads of the ECG? So that is in the 12 lead ECG chest leads. So first lead, that's the V1 is the first lead. Okay, so that one we need to place at the fourth intercostal space. That's the right sternal border. Okay, this is the this bone which is here. So this is the breast bone, or this is the very important sternal bone, what we can say. Okay, so this border of the right side border of the sternum at the fourth intercostal space, this is the fourth intercostal space. Okay, right sternal border, we will place the V1. Okay, so then comes to the V2. V2 is the, that is our second chest lead number second. This is the left side sternal border, again the fourth intercostal space. Okay, again the fourth intercostal space. So that is the right side, left side sternal border is the V2. Okay, so then after connecting the V2, we will directly place the V4. Okay, so that is, this is the clavicle bone. Okay, so beauty bone, that is the clavicle bone, right? So this clavicle bone, okay, this is the clavicle bone full length, and at the middle of the clavicle bone we will draw one line. We call this one as the mid clavicular line. Okay, what we call this one? We will call this one as in the mid clavicular line. Okay, so at the fifth intercostal space, means we will come one step down. Okay, at the fifth intercostal space, okay, in the mid clavicular line we will apply the V4. So this is our very important questions they can ask. Okay, at the mid clavicular line. Okay, then in the fifth intercostal space, which lead will be placed? That is the V4. Okay, so then this is the anterior portion of the axilla. So that is the anterior axillary line. Okay, and at the same fifth intercostal space, in the fifth intercostal space, anterior axillary line. So that is the V5 will be placed. Okay, so here in our question also same they have asked. Okay, in the fifth intercostal space, anterior axillary line, which one we need to place? That's the V5. Okay, so then comes to the V6. V6 will be in the mid axillary line. Okay, at the middle of the axilla, fifth intercostal space. Okay, V6, mid axillary line, fifth intercostal space is the V6. Sir, where we need to place the V3? So beta, V3 will be always placed in between the V2 and V4. Okay, that's the placement of the V3 will be between the V2 and V4. Okay, here will be a very important notes for you all. Okay, V1 fourth intercostal space, right sternal border. V2 fourth intercostal space, left sternal border. V3 directly between the V2 and V4. V4 fifth intercostal space at the left side, which is mid clavicular line, and the V5 fifth intercostal space left side anterior line, and V6 fifth intercostal space at the mid axillary line left side. Okay, so this is the very important notes for you all. So please do take a screenshot and revise at least 1 or 2 times. Okay, here comes to the next question. Yes, what is the normal duration of the PR interval in a healthy adult ECG? Yes, beta. What is the normal duration of the PR interval in the healthy adult ECG? Option A 0.04 to the 0.08 second. Option B 0.08 to the 0.12 second. Option C 0.1 to the 0.20 second. And option D is the 0.20 to the 0.28 second. What goes to the correct answer? Question beta, they have not asked the PR segment. The question was asked regarding the PR interval. So don't confuse between the PR segment and PR interval. So that is the reason I have brought these questions. If they have asked the duration of the P wave, you can answer very easily. If they have asked the duration of the QRS complex, you will answer that one very easily. But if they have asked the PR segment and interval, you will land into the confusion. So I have brought those questions which may create the confusion, and along with that I will solve all the regular question also, and some questions which creates the confusion to in your mind, that one also I will solve. So just focus and just whatever the confusion and conflict creating questions you need to solve in this particular time only, so it will be get easily cleared in the exams. Okay, so here comes to the answer. Okay, so remember better this chart. Okay, so P wave, QRS complex and PR segment, it will be formed only in the 2 to 3 small boxes. Okay, and PR interval, it will get solved in the one big square, and QT interval, it will get formed in a 2 big square. Yes, QT interval is the largest wave or the largest interval it will get formed is in the ECG graph is the our QT interval. Okay, that requires the 2 big square. Okay, and PR interval require 1 big square. Okay, so then the P wave, QRS complex and the PR segment, which requires 2 to 3 small boxes to get formed. Okay, sir, what is the big square and the small box concept? Yes, here is the important thing, just try to understand. So whatever the small boxes are there here, these are called as the small boxes. Okay, and this one is the our big square. This one is the big square. Beta, one big square, it will be having the 5 small boxes. Okay, one big square is equal to 5 small box. Okay, and during the process of the ECG monitoring, the paper it will run at the speed of the 25 mm per second. Okay, so this is the speed of the ECG paper during monitoring of the ECG is the 25 mm per second. Okay, so the paper is running in this speed. Okay, to cross one small box, so ECG machine it will take to cross the one small box. I am talking about the one small box. It will take 0.04 second. Okay, but I told one small box is the 0.04 second. In one big box, how many small boxes are there? In one big box, there are 5 small boxes. Okay, so means to cross this entire big box, how much time it will take? Yes, that is the 0.04 into 5. So what is that one? 0.20 second is required to cross this particular big box. Hope it is clear to every one of you the concept of the small box and big box. Yes, so here comes the one small box is equal to 0.04 second. So that is the one large box is equal to 0.20 second. Okay, so this was the time duration of the ECG. Okay, so similarly comes to the amplitude and height of the wave. Okay, beta, so amplitude, that is the one small box is equal to 0.1 millivolt is the amplitude, or 1 mm is the height. Okay, so height of the one small box is equal to 1 mm, and amplitude of the one small box is equal to 0.1 milli amplitude. Okay, so very important, millivolt. Okay, so that is the very important. So please do remember, means one small box is equal to 1 mm height or the 0.1 volt amplitude, means one big box is equal to similarly, so that is the 0.5 millivolt amplitude, or we can say that is the 5 mm as in the height. Okay, so hope it is clear. 5 mm as a height and 0.5 millivolt as in the amplitude. Okay, this is the what actually the one big box requires. Okay, so this is the very basic thing, just I have explained in a short manner. Okay, so the height is, one small box height is 1 mm and one large box height is 5 mm. Okay, so now I told the P wave and QRS complex pair segment, it will forms in the 2 to 3 small boxes. Okay, so 2 to 3 small box means one small box is equal to what I told, that is the 0.04 second, means two small boxes equal to, that is the 0.08 second, right? Three small boxes equal to, that is the 0.04 into 3, that is the our 0.12 second, right? So 2 to 3 small box means in range it will come 0.08 to the 0.12 second, right? Sir, in the examiner asking the single best answer, what to choose, sir? Choose in between this one, that is the 0.10 second, or just you can say 0.1 second also. Okay, so this is the very important your answer for the duration of the P wave, duration of the QRS complex, duration of the PR segment. Okay, in the options all you got means just try to choose the 0.10 second or the 0.1 second, because after the zero, the decimal like zero, after the dot or the point, that zero don't have value, so I will not writing the zero here. Okay, you can write 0. If you want, you can write 0.10 second also or 0.1 second also, both goes to the same answer here. Okay, so hope it is clear to every one of you. Yes, better I told we need to focus in the question whether the question they have asked on the pair interval or the pair segment. Okay, so if this was a pair interval, so that is the answer goes to the, yes, our one big square, that is the 0.20 second is the best answer. Okay, so one big square 0.20 second is the best answer, and in range it is a 0.1 second to the 20 second. Okay, so here comes to the question, so that is the 0.10 1 second to the 0.20 second is the normal duration of the pair interval. Okay, so very important, please do remember. Okay, hope it is clear to every one of you. Yes, so here is the next question, so please do read the question carefully, completely, and try to give the best answer and the best shot in the particular question here. Magic sessions are going to be a really magicful in your exams. Okay, so when you will see the questions which were solved by the master nursing class of Mr. Nagaraj sir, you will be very happy after the exams, and you will definitely message me, sir, I have cleared my prelims exam very easily with your guidance. Okay, so I am here to guide you, the real aspirants who are really preparing and who are really struggling to clear their exams. Don't worry, your master is here, you don't need to fear. Okay, I will give my best shot before your exams, so you will be happy after giving the exams. Okay, so here is the next question. Yes, in the ECG, two large squares are observed between the two consecutive R waves. Using the 300 method, what is the heart rate? They can ask the question like this, or one more type of the questions. Just they will give a graph and they will ask you to what is the heart rate of this particular ECG graph. Beta, to interpret the ECG heart rate, so we need to have the very basic knowledge here. So what we need to assess first, we need to assess the gap between the two RR waves. Okay, so we need to assess the gap between the two RR waves. Okay, so this is the P wave Q R S T. Again, here is the P Q R S T. Okay, this is the normal ECG. Okay, so here in between the two RR wave, how many big box are there? Yes, so look at this particular similar here. So this is the one R wave, this is another R wave. Okay, this is the one box, two box. Beta, so look at this particular image where it is a graph is created in between the box. If it is crossed the box, then only I will consider this one as the 3. If it is not crossed, I will consider that one as the 2. So first primary like confusion is eliminated, I think so. Okay, so look at this particular wave also here. Okay, so here is the small box is there. Okay, here will be our big box is there, right? So in this one, the wave is formed in between this one, right? If it is crossed that one, so I will count 1, 2, and 3. If it is not crossed, I will consider 1 and 2 only. Okay, so now here in between the two RR waves, so only 2 to R small, sorry, 2 to big boxes are there. Okay, so what is the formula? So formula is here to calculate the heart rate by using the big boxes. Okay, if calculated through the big box, so just you have to keep 300 big boxes divided by the number of the big boxes between the two RR waves. Okay, so between two RR waves, number of the big boxes are the two. Okay, yes, did we seen that one? Yes, we have seen that one here. Okay, so here is the two big boxes are there between the two R waves. One big box, two big box. Here is the one R wave, two R wave. Between two R waves, there are the two big boxes are there. Okay, so I will keep the number of the big boxes below. Okay, so between the two R waves, two big boxes are there. Okay, so that is the two one ja, two 150 ja. Okay, so that's the total heart rate of this particular image is the 150 beats per minute is the very important our total heart rate of the that particular ECG image. Okay, and here in this particular question also there are the two large squares are observed between the two consecutive R waves. Okay, so by using the 300 method means, so I will keep the 300 above and the number of the like big boxes between the two R waves I will keep down again 2 1 ja, 2 150 ja. So answer goes to the 150 beats per minute is the heart rate of this particular ECG wave. Okay, so the second question will comes like this. Okay, so again calculate the heart rate of this particular image. Yes, if anyone of you want to know the entire ECG, the separate folder of the ECG videos is there in the Master Nursing Classes YouTube channel. The 4 very important ECG classes, including the image-based questions, everything in detail by holding the single hairlines of the ECG. Everything is explained. If you want to be a excellent knowledge and the brilliant knowledge on the ECG, please go to the lengthy videos, which means lengthy means very interesting videos are there. Okay, so those videos of the ECG last time total including the prelims and mains. Okay, almost all 99.99 questions were came from the Master Nursing Classes YouTube channel. If you want the proof, there is in the class what you call is in the Norcet 8 paper solution. In that one I have manifested everything with a screenshot. Okay, so you can watch that one also. Okay, as a proof. Okay, so I think my students didn't require the proof because we will strike maximum that you know, everyone know. Okay, so here's the yes, almost all people given the correct answer. This is also a very important between two R waves, two consecutive R waves, I will see the number of the big boxes. Here the 1 2. Okay, here's the 1 2. So similarly two R waves are there, so two big boxes are there between the two R waves. Again similar 300 divided by the number of the R waves, number of the big boxes between the two R waves, 2. Okay, again answer comes to the 150 beats per minute. Okay, if you want to solve this one by using the small box means, just you have to keep 1500 above. Okay, then count the number of the small boxes. Okay, so here one R wave, second R wave, 1 2 big box. Two big box means in each one big box 5 R waves are there. Okay, so total 10 small box will be there. Okay, sorry, in the total two big boxes there are the 10 small boxes are there. Okay, so now between the two big box means there are the two small 10 small boxes are there. 1500 divided by the 10 I will keep, 0 I will remain. Okay, remove. So that's the 150 beats per minute will be again your answer. Okay, so here it will come both same. Okay, if you do by calculation of the 1500, that is for the small box, and for the big box 300. Okay, so both the answer will comes as the same, right? So hope it is clear to everyone of you, right? So here comes to the next question. So please do identify the image and its rhythm, the most important for your upcoming exam. Yes, so फटाफट do read the question and try to interpret the image. Okay, so don't get confused. I will give the clue how to identify the atrial flutter and how to identify the atrial fibrillation. So this kind of the same image only will come in your exam. Try to choose the answer based on the clue what I am giving, so your answer will never get waste. Okay, your answer will never get like wrong here. Which rhythm is most likely shown in the image above? So option is the ventricular tachycardia. How the image of the ventricular tachycardia it will come? It will come like this. Is this looking like this? No. So our answer is not ventricular tachycardia. I'm eliminating this one. And ventricular fibrillation, option D. So that is again, it will comes like this. So this is the ventricular fibrillation. Is that our ventricular fibrillation? Is that waves are looking like this? No. I'm eliminating this particular ventricular fibrillation also. Then comes to the confusion. That is the atrial flutter or the atrial fibrillation. Beta, look at this particular ECG image. Okay, after the T wave, here will be the P wave. It will be looking like this. Okay, after the T wave, again here will be the P wave. Okay, which is looking like this. Okay, if it is looking like this, so this will be a case of the atrial fibrillation. Okay, but in the flutter, how it would look like this? Look at this particular image. So this is the T wave. Okay, so after this is the P Q R S T. After the T wave, here will be our P wave, which is looking like a teeth. Okay, this is the T wave again. After the T wave, our P wave, which is looking like again a teeth. Okay, so it is coming like this. So we call this one as in the saw tooth appearance of the P wave. Saw tooth appearance of P wave. So that is what we call as in the atrial flutter. This is how you have to identify. Okay, so after the T wave, you are getting the P wave, which is looking like a tooth. Okay, so this is what you call as in the atrial flutter. Okay, so please do remember the very important thing, right? So here comes to the image of the polymorphic ventricular tachycardia, or we can say the torsades de pointis. So in the polymorphic ventricular tachycardia, the word itself, it is saying that it is in the poly, means it is the more. Okay, ventricular tachycardia. But in the polymorphic ventricular tachycardia or the torsades de pointis, there are the three different types of the QRS complex will be seen in the image. Okay, so look at this one. So these QRS complex is different, one type, and these particular QRS complex are different, second type of the difference, and comes to the a third type of the difference QRS complex. Okay, so three different types of the QRS complex is coming, means that is what you call as the torsades de pointis or the polymorphic ventricular tachycardia. The drug of choice, remember the drug of choice for the polymorphic ventricular tachycardia or the torsades de pointis is the injection magnesium sulfate, MgSO4 is the drug of choice for the torsades de pointis or the polymorphic ventricular tachycardia, the repeatedly asked question. Okay, so please don't forget this one, right? So here comes to the next images. So you can look at the image here. How disciplined the ventricular tachycardia is that? Yes, it is rising up, falling down, rising up, falling down. Okay, rising up, falling down, rising up, falling down in a disciplined manner. Okay, so this is the ventricular tachycardia. Okay, you can get the image also like this. Okay, so two types of the image you can get. But the ventricular tachycardia, it will comes in a similar way, disciplined way. So that is the ventricular tachycardia. Okay, so image of the ventricular tachycardia. Then here the undisciplined one. So third class disciplined one, that is the ventricular fibrillation. Okay, only heart will shake here, heart will not pump here. Okay, so look at the image. Okay, what happened here? Like this one. Okay, so this is the ventricular fibrillation, don't forget. Okay, so ventricular fibrillation is the this image, ventricular tachycardia is the image what I am shown here to you people, and the torsades de pointis, atrial flutter, and the atrial fibrillation. So these images only will be asked in your exam. Okay, and there is one associated questions along with the atrial fibrillation repeatedly which is coming in the exam. So please do remember the concept what I am explaining you people on the atrial fibrillation. Okay, so if the patient is experiencing the atrial fibrillation or the AF, so at that particular time, so the clot will activate. Okay, clot will activate in the body, and this clot will get dislodged. Okay, it will get emboli. Okay, so this emboli, it will blocks the carotid artery, or it will blocks the pulmonary artery, okay, so there is highest chance of the stroke and the pulmonary embolism is there, especially the stroke. Okay, so you are assessing a patient, okay, who is experiencing the slurred speech, disturbed vision, and what we can say, hemiparesis or the paralysis of the body. Okay, so here there is in the warning signs of the strokes are coming. Okay, and when you will take the ECG, which one you can interpret and which one you can expect. So always associated with condition with the atrial fibrillation is the our carotid artery blockage with the emboli. So the patient will experience the warning sign of the stroke. Okay, so warning sign of the stroke. Warning sign of the stroke. So if immediately patient is having the atrial fibrillation, first drug to be give. First drug to be give is the injection heparin. So please do remember the anticoagulant we will start very immediately in order to prevent the in order to dissolve the activated clot and in order to prevent the blockage of the arteries. Okay, so this is the important one. The patient is having the atrial fibrillation history. Now the patient is complaining of the slurred speech, blurred vision, okay, and the weakness of the body, that is the half hour full of the body. So already patient have on the antiarrhythmic drugs is started. So which drug we will give the next one? Okay, so next best drug we will give is the first drug we will give is the heparin. Okay, in the question they will give for the atrial fibrillation, the already antiarrhythmic drug have been started. So the which one more drug we will give here? We will give the heparin in order to prevent this consequence of the atrial fibrillation. There is a stroke. This is the concept, very important. This will come in your exam, so don't forget the concept. Okay, so hope it is clear to every one of you. And here comes to the next question. Okay, so yes, so try to give the best answer for this particular question which is there in front of you all. Yes, in a Wolff-Parkinson-White syndrome, what is the usual effect of the ECG? Beta, please do remember the WPW syndrome. I will give the one clue. Okay, so this is the QR. Yes, this is this much wide. Okay, and the one more, that is the PR. This is the small. Okay, QRS is, we are writing three words, so this will be a wide. Okay, and the PR is, we are writing only word. This is the small. Along with this one, there will be a delta wave will be there. Okay, there will be a delta wave will be there. Okay, it means QRS complex is wide, PR interval is short, and delta wave positive. So if these three things are there in the ECG, we can easily interpret this one as in the Wolff-Parkinson-White syndrome. What is the usual effect of the Wolff-Parkinson-White syndrome on the ECG? So that is the wide QRS complex, delta wave positive, and short PR interval. So how to remember? QRS is the three words, I am writing a wide, and PR is the two words, I am writing the short, and delta wave is positive. Okay, so how you have to remember this one? We have to remember like this. Okay, so तुक्का मारना है एग्जाम के लिए important. Okay, so yes, hope it is clear to every one of you. And here comes to the next question. Yes, which of the following lead typically shows changes in the inferior wall MI? This is your very important question. Better don't forget the concept and the mnemonic what I am teaching now here in this particular question. This was the question asking in your every Norcet exam repeatedly, and only 6 to 7% of students will able to answer this question because they will feel this one is difficult. But I am here to solve you people with a clear mnemonic, and here how we have to approach this particular lead indicator of the indication of the myocardial infarction area. Okay, so please do remember with this particular mnemonic what I am teaching to you people here. So students, the thing which is the V1 chest lead, V2 chest lead is there, and the V3 chest lead, V4 chest lead is there. Then comes to the V5 chest lead, and the V6 chest lead will be there. Okay, after that there will be a second standard chest lead and the third standard chest lead. Okay, so along with that augmented vector foot chest lead will be there, and the augmented vector right, sorry, not chest lead, augmented vector foot lead, and the augmented vector right is the very very important leads we are having in the ECG. Okay, so if there is in the ST elevation in the V1 and V2 means, so that is what you call as the septal MI. Okay, so there is the septal MI, right? If there is in the ST elevation in the V3 V4 means we will call that one as in the, yes, that is the anterior wall MI. Okay, so that is the anterior wall MI. Then the, if there is in the ST depression on the V5 and V6 is the our posterior, sorry, lateral border MI. Okay, so this is the lateral border MI. Lateral border MI. Okay, if there is any ST elevation on the standard lead second, third, and augmented vector foot, so that is the inferior wall MI. Okay, so this is the inferior wall MI. If there is any problem in the augmented vector right, this is a posterior wall MI. This is the posterior wall MI. So please do remember better. If this particular thing you are remaining means one question is yours in the exams. Okay, so how to remember, sir? Yes, SALA. Sala. V1 V2 is the septal wall MI. V3 V5 is the anterior wall MI. V5 V6 is the lateral wall MI. Sir, how to remember this standard lead second, third, and augmented vector foot as an inferior wall MI? Yes, so you know the nth and triangle, William nth and triangle of the ECG, you know. Yes, in the William nth and triangle of the ECG. Okay, so it will be like this. Okay, so it will be like this. Okay, this one is the right hand, so that is the augmented vector right hand. Okay, and this one is the left hand, that is the augmented vector left hand. Okay, so this one is the left foot, that is the augmented vector foot. Okay, so the right foot is neutral. Okay, so we will not consider that one. In between the augmented vector right and in between the augmented vector left, there is in the standard lead, we call that one as the standard lead number 1. Okay, in between the augmented vector right and augmented vector foot, we have the standard lead number 2. Okay, in between the augmented vector foot and augmented vector left side, so we have the standard lead number 3. Okay, so what I told in the inferior wall MI, so there is the problem in the standard lead number second, foot and third. So it is coming superior or inferior? Yes, it is coming down, right? So this is coming down, no? So this is the lead indicators of the inferior wall MI. So please do remember the standard lead number second, third, and augmented vector foot. It will indicate the inferior wall MI. So this is the very very important thing. Better. So that was asked in our question. Okay, comes to the question now. Where is the question? So here is the question. Okay. So which of the following a lead which will typically shows changes in the inferior wall MI? That's the standard lead number second, third, and augmented vector foot. Okay. Hope it is clear to everyone of you, right? So hope it is clear. Okay. So this was the standard graph what we have for the inferior wall MI. So that's the ST elevation on the standard lead number second, third, and augmented vector foot. Just now we have discussed the concept, and the anterior wall MI, ST elevation on the V3 and V4, and the septal wall MI, ST elevation on the V1 and V2. That is the SA. Okay, so SA. Then comes to the LA. That is the lateral wall MI. So SALA is the mnemonic what we have made and remembered here. Okay, so the same thing is there. Okay, V1 V2 SA. Okay, sorry, yes, and the V3 V4 A, then V5 V6 LA. Okay, SALA, right? So along with it, there's the septal wall MI, anterior wall MI, and the lateral border of the wall MI. Okay, so the with this one, ST depression on the V1 and V3, there is the posterior wall MI, and especially augmented vector foot, it will indicate also. Okay, so very very important. Please do remember the thing what we are writing here and understanding here. Okay, so here's the augmented vector right and augmented vector foot also, both it will indicate. Okay, so the special is the augmented vector foot. Okay, so that's the posterior wall MI is the very very important thing which will be indicated, right? So hope the concept is clear on the lead indication and in area of the MI. Okay, so frequently asked questions. So with the mnemonic and with the concept I have explained to you people, right? So here comes to the next question. Yes, Students, there will be a total three types of the question which will be asked in your exam on the drug calculations. So we have 20 questions in the 18 minutes, and we have very less time to calculate the drug and its doses. So we are paying at around of the 3 to 5 minutes on the one question, means the entire particular section will get damaged. Consider in each and every section, if you are getting the one question on the calculation and you are wasting the lots of the time, is so that is the very difficult. So I will teach you which formula we need to use immediately, okay, and how to identify, so to use the which formula, okay, and what to focus in the question to immediately solve the question, okay. So that is the very, very important thing. And the first thing I want to say to you people, that is better whenever you will see the calculative questions, don't do the mind calculation and choose the answer. It is the request, because the exam which you are giving, that exam is going to give a good life to you people, right? So don't neglect and don't unnecessarily mind calculate and give the answer. You have the hall ticket, and AIMS Delhi have given the permission to write the and calculate the things in by writing by the pen on backside of your hall ticket, okay. So please do calculate the every question and then give the answer in the very, very important exam, because that particular one question is going to like decide whether you will be in the selection list or whether you will be in the out of the selection list. So this is the one suggestion from my side. Don't suddenly go for the mind calculation, go for the paper calculation, and whatever the answer it will comes, choose that one. It will be a very correct one, okay. So next comes to the point of the question discussion here. The doctor orders 500 mg of the drug, and the tablet strength available is the 250 mg. How many tablets will you administer to the patient? Very simple question, okay. So the doctor dose is, yes, the question is on the dose, okay. Here the doctor dose we have divided by the available dose into volume, okay. So here this is the not end of fluid calculation, so we will not keep the volume, okay. So I will keep the volume as in the one here, okay. So no problem, right? The doctor dose which is advised is the he wants to give the 500 mg tablet, but in our store, in our pharmacy, which drug is there? So one tablet is the 250 mg we have, okay. So mg went out, and 250 1 ja 250 2 ja, okay. So here the two tablets I will give to the patient, okay. So this is your answer, right? How we have to use them? Yes, we have to use by the doctor dose divided by available dose into the volume, okay. So that is it will comes to the tablet, okay. So that is the very, very important and correct answer. This is the one kind of the question it will comes in your exam, okay. So like other format they will comes like syrup amoxicillin is there in the 5 ml. So there is 250 mg of the amoxicillin is there, okay. So doctor advised to administer the 500 mg of the amoxicillin syrup. So how much ml of the amoxicillin you will give to the patient? Yes, in a 5 ml we have the 250 mg. So how much ml you will give to give the 500 mg? Is this my this is my question, and you want every one of you should answer in the comment box. Yes, amoxicillin 5 ml contains the 250 mg of the amoxicillin, okay. So doctor advised to give the 500 mg of the amoxicillin. Yes, in the 5 ml 250 mg is there. We will give the 10 ml, so that is the 500 mg will be there, okay. So the 10 ml goes to the correct answer, okay. This kind of the question also it will come, okay. It will comes to the mind calculations also. This particular question it will comes answer easily, but the question which I will show in the next, so this one you don't go for the mind calculation. Now focus. Whenever the question comes on the fluid calculations for the normal patients, first thing just how to look at the question, whether the question have been asked ml per hour or the drops per minute. If the question is on the ml per hour, so that is your answer is very easily it will comes, and drops per minute, then also the answer will comes very easily. But if the question have been asked in the ml per hour and you are applying the formula of the drops per minute, means it will take your 3 minutes, still the answer will not comes to you, okay. So just first focus while asking, while question comes in front of you, so look at that one, ml per hour or the drops per minute, okay. If it is ml per hour, go for the formula of the ml per hour. If it is drops per minute, go for the formula of the drops per minute. Yes, which formula we will use for the ml per hour? Yes, comes to the question. A doctor prescribes administer the 500 ml of the IV fluid over the 4 hours. Okay, so what is the flow rate in the ml per hour? Beta. So very simple. If you want to calculate fluid in the ml per hour is equal to, so that is the volume in ml divided by the time in hours. That's it. The formula. Okay. So volume in ml, how much we have in the question? 500 ml volume we have, and the time in hour, how much we have? That's the 4 hours. Okay. 4 1 ja and 4 125 ml per hour goes to the correct answer. Okay. Yes, is that correct? If you are given the 125 ml for the 1 hour, okay, second hour we have given the 125 ml. So in the 2 hours we given the 250 ml, right? In the next 2 hours we will give the 250 ml, 250, 250, 500 ml. So this is how we have to cross check. Okay. So yes, this is the question. Just you have to focus whether they have question asked on the ml per hour or the drops per minute. Okay. So next question comes to the drops per minute. Choose the correct answer. Yes. In order written of the 1000 ml of the normal saline infused over 8 hours using the 20 drops per ml of the IV set. So what is the drip rate in the drops per minute we need to calculate? So, okay, in the question they have asked the drops per minute. Okay, so that is the drips rate. That is the how many drops per 1 minute you will infuse to the patient. Better for here, if the question comes on the drops per minute, the formula which we have to use is that is a drops per minute is equal to volume in ml into drop factor divided by the time in minute. So high in minute, look at the question, they have asked drops per minute. So whatever the time which is they have mentioned in the hours, so we will convert that one into the minutes. So we will solve this one. Okay. So drops per minute is equal to volume in hour is the 1000 ml we have, and the drop factor we have is the, so that is given as in the 20 drops per factor. So it is the macro drip set. Okay. So big drip set or the macro drip set. Okay. So 1000 into 20. So divided by the time in minutes. Okay. So 8 hours is the time they have given, and to convert it to the minutes, I will I will multiply this one into the 60. Okay. So here a 0 0 I will remove, and the 2 1 ja and 2 3 ja. Okay. So here comes to the next. ಎರಡು ನಾಲ್ಕಲೆ 8 and ಎರಡು ಐದಲೆ 10. So next 2 2s are 4, then the 250. Okay, so then comes to the 2 1s are 2 125. Okay, so is the 125 divided by remaining 3 is here 3. Okay, so here comes to the 41.6. Okay, 41.6 it is coming, means the answer goes to the our 42 drops per minute. Okay, so this is the very simple thing which we have to keep in our mind. Okay, so this is the correct answer. Okay, so you can cross check later. Okay, so just my purpose of bringing this question of the fluid calculation is to just you have to focus immediately whether the question have been asked in the drops per minute or the ml per hour or the divide doctor dose and available dose. Okay, so if the ml per hour, don't need to consider the drop factor, just keep the how much ml it is and what time it is, divide, the answer will be comes. Okay, very simple. Okay, and the drops per minute we need to consider the drop factor also for the macro drip set. Okay, if they are in the question they have mentioned it is in the micro drip set, especially if they have mentioned a pediatric patient or the pediatric patient, if they have mentioned the question, or the micro drip set they have mentioned in the question, means so that is the drop factor will be 60 drops per ml will be the drop factor for the pediatric patient, or for the micro drip set that is the 60 drops per ml will be the drop factor. Okay, for the adult patient and the macro drip sets, the 20 drops per ml will be the drop factor. Okay, so that one we have to consider here, right? So hope people enjoyed this particular session what we have discussed in this today. Okay, so in the tomorrow session we will again discuss the very important questions and concept. So thanks for completely watching the video till the end, and I hope every one of you are preparing the well. And in the tomorrow session also I will come up with those very important question which will reflect on your computer sessions. In the today's session, definitely at least 2 or 3 questions you will get directly in the exam, whether the questions will come directly or the concept what I have taught to you people will come directly. Okay, so Hope you people have enjoyed the today's session. We will meet again in the tomorrow session with the same energy, with the same josh. Okay, so don't forget your comeback story or the bounce back story should be stronger than the or more stronger than the your setback story. Okay, so don't think what other people will say about you, whether they will save you or whether they will say they will say you a bad man, or they will say you, or they will comment on you as on the bad girl. Okay, don't think about anyone. Just the thing you are doing is looking good to you. You can practice that one. You can achieve that one. If it is looking wrong to you, don't go for that. Ask for someone who is looks like expert in front of you, so you can take suggestion from that one and you can move on. Okay, so don't think about the unnecessary people's what they will say, and don't overthink. Just work on your thing, work on yourself. The championship and the victory will be yours. Okay, so thank you so much for watching the video. And for the real time exam practice, again I'm mentioning, for the real time exam practice, the master nursing classes app link I have given in the description box. And if you any one of you want to watch the ABC video, complete video, okay, that is 1.5 hour video, 1.5 hour video, all the possible questions I have covered of the ABC. So I have mentioned the link in the description box. You can go through that one. And if any one of you want to watch the mechanical ventilator video also, the link is there, and the videos are there in the YouTube. You can watch. Okay, so go for the playlist. In the playlist, separate videos I have kept. You can watch and enjoy and learn and get the knowledge and get the success. Thank you so much for watching the video till the end, and we will meeting in the tomorrow session again. So thank you so much. Love you all. Bye bye. Take care. Jai Hind. Jai Bharat. All the best.